First, our top story here tonight. Singapore is ramping up on social distancing measures, starting with the suspension of community activities for the elderly. Now, the move is designed to protect this vulnerable group while stemming the spread of COVID-19. All senior-centric activities, including those run by community centres and residents' committees, will stop for 2 weeks. That's from the 11th to the 24th of March. This move comes after recent confirmed cases were linked to the Safra Jurong cluster and other social activities. Evidence shows that some individuals who were unwell had continued to take part in these activities. About 290,000 participants and 2,600 classes will be affected, according to the People's Association that runs programs at CCs. Additional precautions will be implemented before activities resume. Now, these include reducing group sizes, reorganizing activities to minimize physical contact, and increasing the frequency of cleaning equipment. Care services for seniors will also step up precautionary measures. The multi-ministry task force says that more social distancing measures may be implemented in time to come. That's based on data, evidence, and expert advice.
Going forward, we will look at the fuller range of social distancing measures we can put in place, including for public events, community activities, school closures, workplace social distancing, including things like staggered hours, telecommuting, as well as religious services too. If we were to do all of them at one time, we will literally have to shut down our city and everything will grind to a halt. If you were to start some of them too early, people may become fatigued and then you cannot sustain the measures and then it will not be effective either. So getting the measures right and applying at the right time is critical.
The authorities have established a pattern of transmission among recent confirmed cases. The pattern shows that many of the cases were infected during social activities among seniors. That's why additional measures are rolled out to protect them. But the authorities emphasize that it is because they are a vulnerable group and not because they are the cause of transmission. They have also urged people to stop doctor hopping and established that amongst the confirmed cases, 38 had visited more than one GP, of which 8 of them visited 3 or more. They said this impedes effective contact tracing. Authorities have also emphasized social responsibility. There was evidence that about 35 of the confirmed cases had not minimized social contact, although they developed fever or respiratory symptoms or consulted doctor early. More than a fifth continued to work or carried on with daily activities seen at Wislearn Technologies and the Safra dinner function. As to how long this COVID-19 situation will last, the authorities are expecting it to last till the end of the year, but they cannot determine if large-scale events such as the National Day Parade will be postponed or even cancelled.
The total number of infections in Singapore currently stands at 166, and the total number of recoveries remain at 93. 73 patients remain in hospital, with 12 of them in critical condition in the ICU.